Hello, Namaskara. This is Dr. Manjunath Awadkhan. Welcome to my YouTube channel. Today I am discussing very important update from Nelson 22nd edition, that is gene therapy in beta thalassemia. This slide shows treatment, whatever treatment we are using for transfusion dependent thalassemias. So we are using regular blood transfusion, chelation therapy, hydroxyurea, and hematopoietic stem cell transplantation. Now the new Nelson mentions about gene therapy also. Mainly there are two types of gene therapies. Either you can do gene addition or you can do gene editing by using CRISPR-Cas9 mechanism. And gene addition is done by lentiviral vector. There are two genes. One is Zyntiglo and another is Casgevy. Zyntiglo and Casgevy are brand names. So Zyntiglo is known as beta-baglozine autotem cell and Casgevy is hexagamglozine autotem cell. I know it is difficult to remember, but we have to remember it because this is a recent update and can be asked in any theory exam as well as NEET PG, NEET SS, as well as INI SS. So Zyntiglo is approved for 4 year and above, wherein Casgevy is approved for 12 year and above. And what's its effect? Zyntiglo improves HbA level, wherein Casgevy it improves HbF level by inhibiting BCL11A gene, which is present in RBC precursors. Usually this gene BCL11A gene suppresses HbF production. Okay, so what's the success rate? Approximately it is 90% in both Zyntiglo and Casgevy. Nelson doesn't talk about Casgevy success rate, but I have taken it from some article. Okay, so this is a transfusion independence rate after single one-time gene therapy. Okay, Casgevy was previously approved for sickle cell. Recently, it is approved also for beta thalassemia, transfusion dependent beta thalassemia. This is the Nelson 21st and Nelson 22nd edition screenshot. Let's read Nelson 21st edition. Gene therapy approaches are under study and early result with lentiviral vector have been promising, but it doesn't mention any gene therapy. But in 22nd edition, Nelson talks about gene therapy. We have to remember everything about gene therapy. Using gene addition or gene editing approaches are approved for transfusion dependent thalassemias or beta thalassemias. Gene addition using lentiviral vector, that is beta-baglozine autotem cell, approved for more than 4 years, and it uses CD34 autologous cells, and approximately 90% treated patient achieve transfusion independence. This is the image deficiting both gene editing and gene addition therapy. First we have to select the patient whose LFT is normal and he is well chelated. Okay, once you select the patient, you take a auto cells, that is CD4 stem cells. Once you have taken CD4 stem cells, they are taken to in the lab. Either you do gene addition or you do gene editing. Gene addition is done in Zyntiglo and gene editing is done in Casgevy. Okay, so as I told, gene addition is more than or equal to 4 year and gene editing is more than or equal to 12 year. So once you done the editing or addition, you can transfer back to patient, and patient should be conditioned using myeloablative chemotherapy. Okay, these are the major difference between stem cell therapy and gene therapy, hematopoietic stem cell therapy and gene therapy. HLA matching is required in hematopoietic stem cell therapy, but it is not required in gene therapy as own cells are used. Donor is required in hematopoietic stem cell therapy donor is not required as own autologous stem cells are used. Graft versus host disease is common in hematopoietic stem cell therapy, but it is not seen in gene therapy. Conditioning required in both, but side effects are less in gene therapy. So it becomes an advantage in gene therapy. This is the image depicting allogenic hematopoietic stem cell therapy and gene therapy using patient's own cells. Thank you.